my project, I'm doing it on borderline personality disorder. Borderline personality disorder is a mental health disorder that impacts the way you think and that you feel about yourself and others. It is when you have a fear of abandonment and have a difficult time with being alone. You also have frequent mood swings, which makes it difficult to hold relationships, friendships, and jobs. How does it compromise your everyday function? It can affect your relationship with your friends, family members, or your significant other. You also have a hard time finishing your education, jobs. It's hard to keep your jobs because your just mind's racing all the time. And you can have legal issues with the law. In most severe cases, you can self-mutation by cutting or burning yourself, or you can have suicidal thoughts, or you can try to commit suicide. What is the common cause for borderline personality disorder and the risk factors? So the common cause is from a family member. It is genetic. If you're a close family member, like your siblings, your mom, your dad, cousins, grandparents have it, there's always a possibility that you may have it, or you could have a disorder that is close to borderline personality disorder. So there are many disorders that have risks, like this one. Is when your family member has the same disorder, or if you had a troubling childhood, which had a lot of stressful events in it, such as being abused emotionally or physically. The typical age on onsets for this disorder, and who is at the higher risk is people in their early adulthood, and it worsens over time if you do not get help. In some cases, it just gets worse when you do grow up, or some people it may get better, but in most cases it worsens over time. Is there a medication that is commonly used for this disorder? So there's no medications specifically for treating this disorder, but there are medications to help some of the symptoms, such as antidepressants, antipsychotics, mood stabilizers, and anti-anxiety medications. So identify and explain if there's any special considerations with this medication. So there are medications that can worsen some of the symptoms for different individuals, and some of them can become a habit forming, which means you could become addicted to some of them. It all just depends on the person. And antidepressants actually carries a black box warning on it, which can cause an increase of suicidal thinking in some individuals. What patient teaching would be appropriate and interventions I would use? So counseling or therapy would help the most. I feel like counseling, therapy, or support groups are the thing that most people use to get better. So you would just teach them on on the websites that you can use to find it, the numbers that you can call, and you can teach them healthy habits. Healthy habits really help the mindset most of the time. So it can help with the depression, your anxiety, and in some cases it could just take away some of the symptoms. If you abuse drugs, there's some ways you could change that. So some of those things is you could change your diet. So you could go to a dietitian, which could be recommended by a doctor. Get better sleep. So you want about 10 hours of sleep every night, and it's better to get on schedule so your brain gets used to it over time. It takes about 6 to 3 months. And to start exercising, you could just go as a little run or just a walk, and just get up to it, because it helps the mindset a lot, and it also helps your body. So how to assist with the individual coping and management for this disorder? So you should encourage the person to see a doctor or a mental health provider or a therapist, but you don't want to force it on them, because it could cause an issue between you and the other person. You could also try yoga or meditation. It helps with your stress a lot, and a healthy brain is a very good thing. So you can also write all your goals down and ways to achieve them. That's what I have. You just buy a little book and you just write down all the goals you want throughout life, and just ways to achieve them, and make sure you achieve them. Do like a vision board or anything like that, just to keep your mind on the goals and trying to complete them. So another one is just getting into different hobbies. For me, learning to cope with my anxiety and depression, I started painting and collecting records to paint on them, and it really helps me out. It makes me focus on that instead of self-mutation or just sleeping all day and things like that. It really helps. So just try out different hobbies and see which one that helps you most, and which one sticks the most. So list and explain community resource and how to manage. So you can call a suicide hotline if you are thinking about suicide or having those type of thoughts. They can help. You can call a mental health hotline, which can be all found online, so you can always have access to it. And at school, usually they hand out a little card which has all the different types of numbers on it, which can help you. You can find a support group for mental illnesses. Depending on where you live, you can find support groups on your individual disorder, like bipolar disorder, depression, and stuff like that. There's different support groups for different things. But if you cannot find one for your own individual disorder, you can just go to a mental health one, and with that helps us all of them, and that could really help you. You could also talk to a therapist online or in person. There's multiple ways to communicate with a therapist. There's multiple websites that can get you to new numbers for different therapists, and you can also just go in person. There's lots of therapists usually, even in small towns, you can find one. So how is an individual clinically diagnosed and identify the criteria? So if you have symptoms like a fear of abandonment, a pattern of unstable relationships, changes in self-identity and self-image, stress-related paranoia, impulse or risky behaviors, suicidal threats or self-injury, wide mood swings, ongoing feeling of emptiness, or intense anger, you could have this disorder, and you should go see your doctor or mental health provider. So, are there any stereotypes associated with this disorder, and how can a barrier to get treatment? So with this disorder, there are many different ones, but some people say people with this disorder are manipulative, but they're really just seeking for reassurance. People with this disorder have this emotional need that have to be met, which some could say is manipulative, but it's not for them. Also, people say borderline personality disorder is untreatable. Just because they do not have a certain medication that goes with this disorder, just get rid of it, doesn't mean you cannot cope and manage with it. There's lots of medications that can help with certain symptoms that could help make it go away. That won't go away, but it can just help with most of the symptoms and make you manage it more. So they cannot have a stable relationship. So they do have troubles with their emotions, which can make it difficult for the partner, but if the partner will do some research and learns ways to just help manage it, it should it should help out the relationship, but they can definitely have a stable relationship. Self-harm is a form of attention seeking. So when I self-harmed, I used to feel nothing, and I would always feel numb, so that's why I did it. And some people just do not understand unless they are in the same situation. So all you can do really is just not listen to people who say things like that. So all those things are really troubling to the mind for all those stereotypes, and it really hurts them, which can make them embarrassed or just too nervous to get treatment. Or in some cases, it could make them overthink it so much that they could try suicide. So all these, people with mental health illnesses always get a negative stereotypes. No matter what they do, even if they do get help, it's always just people is a barrier. It's just so hard to get treatment because it's either your family disagrees or your friends disagree, or someone always says something to you which makes you so nervous, and you just try to ignore your own illness, but it just doesn't work. And it just keeps getting worse and worse. So all you can really do is just get people around you that can support you and encourage you to get treatment, because treatment is the best way to help cope and manage. Okay, that's it.